This multivitamin is used to treat or prevent vitamin deficiency caused by a poor diet, certain illnesses, or during pregnancy. Vitamins are essential for the body and help maintain good health. When taking women's 50+ advanced 400 Mcg-20 Mcg tablet multivitamins, it is recommended to take it by mouth, usually once daily or as directed by your doctor. It is important to follow all directions on the product package and not exceed the recommended dosage. Taking this medication regularly will help you get the most benefit from it, so try to take it at the same time each day to help you remember. If you have any questions about the medication, be sure to ask your doctor or pharmacist for guidance. Some common side effects of women's 50+ advanced 400 Mcg-20 Mcg tablet multivitamins may include constipation, diarrhea, or upset stomach, but these are usually temporary and may go away as your body gets used to the medication. If any of these effects persist or worsen, it's important to notify your doctor or pharmacist promptly. It's important to remember that your doctor has prescribed this medication because they have determined that the benefits to you outweigh the potential risks of side effects. While many people using this medication do not experience serious side effects, it's still important to be aware of potential allergic reactions. Seek immediate medical help if you notice symptoms such as a rash, itching/swelling, especially of the face/tongue/throat, severe dizziness, or difficulty breathing. This is not an exhaustive list of possible side effects, so if you notice any other effects not mentioned here, it's essential to contact your doctor or pharmacist. As for the best time to take this medication, it's recommended to follow your doctor's instructions and the directions on the product package. Typically, multivitamins are taken once daily, usually with a meal to help with absorption. It's important to follow the dosage instructions provided by your doctor or pharmacist for optimal benefits. It's important to keep multivitamins containing iron out of reach of children, as accidental overdose can be fatal in children younger than 6 years. If overdose does occur, seek medical help immediately or call a poison control center. Before taking women's 50+ advanced 400 Mcg-20 Mcg tablet multivitamins, it's important to talk to your doctor or pharmacist if you have any allergies to its ingredients, soy/peanuts, or any other allergies. This product may contain inactive ingredients that could cause allergic reactions or other issues, so it's best to discuss this with your pharmacist. It's also important to inform your doctor or pharmacist about your medical history, especially if you have a history of alcohol use/abuse, liver problems, or stomach/intestinal problems such as ulcers or colitis. If your multivitamin contains folic acid, be sure to inform your doctor or pharmacist if you have a vitamin B12 deficiency, pernicious anemia, before taking it, as folic acid may affect certain lab tests for vitamin B12 deficiency without treating the anemia. Untreated vitamin B12 deficiency can lead to serious nerve problems, so it's crucial to consult your doctor or pharmacist for more details. Before undergoing surgery, make sure to inform your doctor or dentist about all the products you are using, including prescription drugs, non-prescription drugs, and herbal products. If you are pregnant, it's important to inform your doctor before using this medication, as well as consulting your doctor before breastfeeding, as this medication can pass into breast milk. When taking women's 50+ advanced 400 Mcg-20 Mcg tablet multivitamins, it's important to be aware of potential drug interactions. It's possible that this multivitamin could affect how other medications work or increase the risk of serious side effects. Be sure to keep a list of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and share it with your doctor and pharmacist. If your multivitamin contains iron, it's best to avoid taking it at the same time as antacids, bisphosphonates, levodopa, thyroid medications, or certain antibiotics. It's important to ask your doctor or pharmacist about the best timing for taking these medications to avoid any potential interactions. Additionally, if your multivitamin contains folic acid, it's important to inform your doctor or pharmacist if you are taking certain anti-seizure drugs, as there may be interactions to be aware of. It's also important to note that this multivitamin may interfere with certain lab tests, potentially causing false results. Make sure to inform lab personnel and all your doctors that you are taking this medication. If someone takes too much of this multivitamin and experiences severe symptoms like passing out or difficulty breathing, it's crucial to seek immediate medical attention. In the U.S., you can call the local poison control center at 1-800-222-1222. In Canada, contact a provincial poison control center. Symptoms of an overdose may include stomach pain, nausea, vomiting, and diarrhea. Make sure to keep all your medical and lab appointments. It's important to note that some brands may also contain ingredients such as docusate. If you have any questions about the ingredients in your brand, be sure to ask your doctor or pharmacist. Remember, this product is not a substitute for a proper diet. It's best to get your vitamins from healthy foods, so be sure to maintain a well-balanced diet and follow any dietary guidelines as directed by your doctor. If you are prescribed to take this product and happen to miss a dose, take it as soon as you remember. If it's almost time for your next dose, then just skip the missed one and take the next dose at your regular time. Do not take a double dose to make up for the missed one. It's important to store women's 50+ advanced 400 Mcg-20 Mcg tablet multivitamins at room temperature, away from light and moisture. Be sure to keep them out of the bathroom and out of reach of children and pets. When it comes time to dispose of the product, don't flush it down the toilet or pour it into a drain unless specifically instructed. Instead, consult your pharmacist or local waste disposal company to properly discard the product when it's expired or no longer needed. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.